I am Dr. Nicole Bain, and this is our preoperative video for sedation. I love conscious sedation. Sedation is wonderful, but I do want to review some things that you should expect. One, conscious sedation is not going to have you fully out. You're not going to be knocked out and unresponsive. I do have several patients that have gone into very, very deep sedation where it was difficult to rouse them. But typically what happens is you're just really relaxed and sleepy. You can still talk, you can still get up. You just aren't able to drive or walk around safely. You are sedated. The side effects of the medication are anxiolytics. A lot of them are in the benzodiazepine family. And so anxiolytics break up the anxiety. But the side effects of a lot of these are amnesic. So even though you're talking, you might even say, I'm really scared, I'm nervous, am I sedated enough? But you won't remember any of it. So that's a beauty of a lot of these drugs. They're very safe. We cannot kill you with them. We cannot overdose you with them to where you can't be aroused or in any way complicate your breathing. They're very, very, very safe. We will have you hooked up the entire time to a pulse oximeter that monitors your blood pressure and your oxygen saturation rate, as well as your temperature. So it's a very safe procedure. And we also keep the medications here in the office so we can cocktail you and get you deeper and deeper should you need that throughout the procedure. What it'll involve is having all of your consent forms and your prescriptions picked up prior to your appointment. Typically I use triazolam as my first go-to, and I'll mix that in with the Valium. Now the Valium you'll take the night before, and even if your appointment isn't until the following day afternoon, it does tend to stay in your system, and it really, really upregulates the triazolam soaking into your system. When you're here, should you need to go deeper, we have hydroxyzine, lorazepam, and a couple other drugs that I might cocktail in also, depending on what the patient's needs are. Typically, we don't need to use a lot of other drugs to mix in. The minimal ones we use are often very, very effective. People with severe anxiety, previous drug use issues, or other issues with metabolizing drugs can be a little more complicated. So that's just an important discussion you would have with me prior to your appointment. When the day comes of your appointment, we would want you to have a driver. We would get the driver's cell phone number, and we will contact them when the procedure is wrapping up to come and get you. And then we'll escort you to your car. So the day of, just wear something where your sleeves are really accessible for us to get your arm out, because when you do have the monitoring equipment on, you'll be wearing a blood pressure cuff the entire time. And in order to have that be accurate, we need to have it right here on your arm. So if you have a thick sweatshirt on and you can't pull your arm out of it, it's actually not going to work. So please wear something with short sleeves, and if you do need a sweatshirt, have it be like a hooded sweatshirt with a zipper that we can pull your arm out easily. Any other questions you have, feel free to ask me at any time. Send me an email or rewatch this video. I hope you found this helpful.